And we're going to be talking about chapter 13 of Beyond the Pill, which is the alternative means of preventing pregnancy. So this was totally your favorite chapter. Truly Chantilly, I believe it is, just said this is her favorite chapter, which is chapter 13. So we're in Beyond the Pill, and the number one, so if you've read Beyond the Pill, you'll know that step one, people always ask, like, what's the very first thing I want to do? I got to stop birth control. I want to get off of it. I'm having symptoms. It's not working for me. What's the very first thing that I should do? And the very first thing that you should do is get a backup method if you do not want to have a baby and if you do want to have a baby. So as you'll recall from the fertility chapter, I talk about some of the risks associated with getting pregnant within 6 months of coming off of birth control. We know from a 2018 study, yes, the book is on sale in the UK. And yes, I see step one, backup method. Yes, step one is backup method, because whether or not you want to have a baby, it is not time to have a baby when you come off of birth control. You really need to do some work to support your body. And I know there's a lot of doctors out there who saying birth control, you can come off of it and you can get pregnant the next month. Maybe you can, but you don't want to. And the reason for that is everything that I've outlined in the book. Nutrient depletions alone. If you've been taking a medication that depletes folate and your baby needs folate to be able to have cell differentiation and not be at risk of things like spina bifida, like that is when the spine doesn't form fully and we can there's also other risks, like your baby could be born without a brain. Like that's some scary, scary stuff. And that is not to freak you out, but to say you can't be deficient in folate when you enter into pregnancy. Birth control depleted folate, we've got some work to do. Replenish the nutrient store so you can have the healthiest birth outcomes and the healthiest pregnancy. So chapter 13 is the alternative birth control methods. And I open this chapter up by saying, I want to begin this chapter by acknowledging that the only person who truly understands your body and what it needs is you. You're the only one who can determine whether or not the benefits of taking the pill outweigh the risks. If I've done my job right in this book, it has given you the information you need to make that decision. So I just want to take a moment so that we can all acknowledge that, like, the only person who can decide what's the best and going to be the most effective means of preventing pregnancy is you. And that's the information I provide you in this book. So I do talk about FAM, fertility awareness method, and I get right into that. You'll also notice in the book that I say, if you want to learn about FAM and you really want to have it dialed in and do it right, meet with a fertility awareness educator. They are the people who are in the know. And yes, your doctor might be trained in that. That's fantastic if they are. But if not, if your doctor dismisses fertility awareness method and then says, oh, it's the rhythm method or something like that, they really don't know what they're talking about. Most doctors, if not, now I would venture to say there are no doctors that are actually trained in fertility awareness method as part of their core curriculum of becoming a physician. This is why we need all of the healthcare providers, including fertility awareness educators. They are awesome. So the fertility awareness method I go into right away, and I talk about the science of it. And so the reason why I talked about the science of this and what's going on with fertility awareness method is because doctors are some of the most biased people when it comes to FAM. Like they won't even listen. A lot of times when women go to them and say, and you can let me know on Instagram if this is true for you, if you've had this experience, like the biggest joke that I hear is that doctors will say, oh, you're doing the FAM method. Yeah, we call that the it's so ridiculous. The same thing. I'm not doing ever to prevent pregnancy. And so many of my patients actually proved that you can. I've had so many patients practice fertility awareness method, and then when they decide to get pregnant, like they're pregnant the next month because they knew when they were ovulating they had it dialed in. And why do I share that? Because it isn't just that they were infertile, which is sometimes doctors will say, well, they had such a hard, they wouldn't have gotten pregnant anyways. I don't know about that. So things we need to know about fertility awareness method. You ovulate only one egg each menstrual cycle. The egg lives for no more than 24 hours. Sperm are patient little creatures that hang around for several days looking to impregnate you. Those sperm be tricky. You've heard me say it before. And add all of this up, and you're potentially fertile for a max of 8 days out of your cycle, but typically 6. This was an eye-opening moment for me in medical school when I realized that I had just popped my pill that morning, suppressing my hormones every single day, yet I only had a 24-hour window, which I was fertile. And it was really a week max that I'm fertile. Like I could get pregnant out of the month. That's one out of 4 weeks out of the month that I could get pregnant. And you shouldn't have to go to medical school to know that. Like this is your body. You should know that. So I wanted to jump right into the fam talk. We're going to go a little bit further, but in chapter 13, like all the chapters of Beyond the Pill, we give you the highlights, which is how to use fertility awareness method, just how effective non-hormonal birth control options are, clearing up condom confusion, how diaphragms and sponges work, and is the pull-out method legit? I'd love to see you vote. What do you think? Is the pull-out method legit? Yes or no? You can just tell me in the comments, yes or no. So I go into, does FAM really work? Fertility awareness method. I give you the fertility basics, like how to know if you're fertile. This is like, you need to know this whether you want to ever have a baby or not. You need to know, when am I fertile and what's going on with your body? This is important data to gauge your menstrual cycle. And the reality is that we focus a lot on the period. I don't know who came up with the idea that the period was the focal point of the menstrual cycle, but so many of you'll hear me say it, you'll hear Dr. Laura Brighten say it. You're hearing more and more really brilliant female experts out there saying the focus of the menstrual cycle is ovulation, and it really is. And it was Holly who wrote Sweetening the Pill. I saw a quote today that she shared about how before science and medicine ever sought to understand the menstrual cycle, they sought to control it first. So it's so true. And I love Holly because she's a patient advocate. She's not a clinician. And so she brings such a fresh perspective. I'll be doing an interview with her in the future, but it's so true that we sought to suppress a period before we sought to understand how the whole cycle worked. So Thunder Hunch, I'm so confused. How is a woman fertile for 6 days if the egg only lasts 24 hours? So some of you are gonna be like, why are you taking questions right now? You said you'd take them at the end, but because it fits so nicely. So that comes down to again, I grabbed a new book. I shouldn't do that. Page 274. You ovulate only one egg in each menstrual cycle. Sperm are the patient creatures. They wait around for several days. So what happens in the menstrual cycle, and if you go into the Lowdown on Your Hormones chapter, there's a video on YouTube and IGTV as well. I talk about how the menstrual cycle works. Now, libido spikes. Your body is so smart. Libido spikes, you get in the mood, then you have sex. Ejaculate enters into the vaginal canal and makes its way to the uterus. So that's semen, sperm. And with that, those guys will wait around. So your libido spikes, somewhere around like 5 days, just on average. Just trust me on this one. You can be less and you can be more, and it's okay. But when your libido spikes, then we know ovulation is likely following, and you'll have that fertile cervical mucus, the superhighway for sperm that also nourishes them so they can get to the egg, and they'll hang out and they'll wait around. Then when you release an egg, then the sperm are present, and then you can become pregnant. So the 6-day window is really about that 24 hours meets the 5, to 6 days that sperm can live. And so this is where, when people say, fertility awareness method failed, or the other thing is that there was some criticism of natural cycles and Daisy, which is one tool you can use for FAM. You don't have to use those, but they said, oh, well, there were women who did get pregnant. And it's like, well, let's not forget that all forms of contraceptives, whether it be hormonal or non-hormonal, come with the risk of pregnancy. There is a failure rate to every single method. And while people will say, oh, well, the pill is 99.9% effective, it wasn't until I landed in the ER room with an ovarian cyst and a nurse laughing at me when she was like, we have to take a pregnancy test. I'm like, why are you going to do that? I'm on the pill. And she laughed and was like, it's not. I was like, it's 99% effective. And she's like, not the way you're taking it, honey. I'm like, what are you talking about? Oh, snap. As it turns out, with typical use, the pill is only 91% effective. Now, the other thing with fertility awareness method is understand that your biology will override like your common sense. Like you will be like, I can't have unprotected sex, because I'm in my fertile window. That waking up in the day, but then he smells good, he looks good, and there you find yourself having unprotected sex. And look, I ain't judging anybody. This is biology. This is what your biology drives you to do. So with that in mind, if you're using fertility awareness method and you don't use a barrier method or avoid vaginal intercourse with a penis, whenever we're talking about not having babies, that's what we're talking about is male anatomy meets female anatomy, sperm meets egg. But with that, you can do other things or you can use barrier methods. But if you don't, you're rolling the dice and you're really gambling. And so with that, for the women who said, okay, so some women said, yes, the pull-out method's effective. For some women, some of you are like, only if he does it right. Like, we're going to talk more about that. That I'd love to hear, what do you think about the pull-out method? Because when I got into the research, seriously, you guys, I had my mind made up. I was like, I don't know about this fertility awareness method. And then my patient showed me, and then I got into the research and I'm like, oh, okay. So that's real. So I talk about the standard days method, the cervical mucus method, the 2-day method, the symptothermal method. So these are all different methods of FAM. And, the way I really recommend it is that you couple measuring your basal body temperature along with knowing your physical changes of your body. So even I see some of you love natural cycles. Some of you are saying you love Daisy. I love them, but it's not, you can't take a back seat to your fertility. And so it's not something where you can just trust the front thermometer to do all the thinking for you. It is a tool that you use along with knowing your body. And in the current, I'm in the United States. I actually didn't ask you guys where you're at today. But, we've had a lot of scares in the last few years that we're going to lose contraceptive access. And believe me, I would never advocate for that. However, the one thing that no law or politician or government can ever take away from you when it comes to your fertility is knowing your own body. So knowing your fertile cervical mucus, even going as far to work with a FAM educator to know cervical position and all the signs and symptoms and doing the tracking and the basal body temperature that show ovulation. Listen, ladies, this can be 99% effective, this FAM method with perfect use. My clinical experience is that if women are using FAM, they are going to be perfect about it because they aren't taking a backseat to their symptoms. But if you're ever afraid of I might lose my contraceptive devices or pills or whatever, know that you can always be in charge of your fertility by knowing your body so well. So I do talk about fertility apps in this chapter. And then we talk about how breastfeeding does not prevent pregnancy. So be in the know on this one. And, bit of that is that when prolactin goes high, we're not ovulating typically. That's one cause of amenorrhea. And with that, with breastfeeding, women would observe that they didn't get pregnant right away. But know this. Ovulation precedes menstruation. You ovulate first, then you menstruate. So before your period ever comes back, you can ovulate and get pregnant while breastfeeding. And I have had patients who've gotten pregnant in the first 6 months. So I've had patients 2 months after having baby get pregnant. That is rough, you guys, to be just recovering from giving birth, not sleeping with a newborn, feeding a newborn, and then get pregnant. So I want you in the know on that. I talk about condoms and I go through what to know about condoms and how they fail and what you got to know about latex and spermicide and natural, the lambskin condoms. And I also talk about the synthetic condoms and help you know the things that your sex ed teacher should have taught you. Because I think my memory now, okay, granted, it's been a bit since I've been in high school. And I didn't like high school, so I'm not one of those people that replays the glory days. So it's been a minute. But I just remember the condom on the banana and no real talk about you could have a latex sensitivity. So I talk about that. And then we go into what is the cervical cap? How effective is the cervical cap? I talk you through that. I talk you through the sponge. Then we go into the copper IUD and talking about what is the copper IUD. Now, hands down, copper IUD is one of the most effective means of preventing pregnancy when it comes to medical intervention. So devices or medications, it is seriously effective. However, I do know, I have a friend actually that had 2 kids and his 2 daughters are teenagers. And then his wife became pregnant with their now 6 or 7-year-old son. Well, she had a copper IUD. So it is possible. Nature can find a way. And that's why I started this with saying that every form of contraceptive has a failure rate to it. And you can get pregnant with any form. And I've also had patients get pregnant on the copper IUD. However, with the copper IUD, if you have a copper toxicity issue, I definitely think you should follow up with lab testing if you get that tested. If you have endometriosis, heavy periods, painful periods, not for you. Just don't do it. I did it. I was stubborn. I was like, I can do it. Wasn't good. All right. So, are we ready for the withdrawal pullout method? So, for those of you who are voting, yes. So when done correctly, it's about 96% effective. So wait a minute. If done correctly, the pull-out method only has a 4% failure rate. Yeah. So whenever people like when patients would say to me, like, I use the pull and pray method, or what's the other one? Coitus interruptus. People have such cute names for all of these things that go down in the bedroom. So with that, I had to look into that. But I want to say this. That said, if your man isn't quick enough, it's about 80% effective. So it really comes down to how much you trust your partner's agility. As a doc, I'm not comfortable with a form of contraceptives that a woman can't be 100% in control of. In my opinion, you are the boss of your lady parts. And yes, truly, Chantilly, this blew your mind. Yeah. So, would I recommend the pull-out method? No, I wouldn't recommend the pull-out method because there is also a phenomenon known as pre-ejaculation, more commonly called pre-cum. Yes, that is a thing where it's like they can ejaculate a little bit, but it's not the full orgasm yet. And there can be live sperm and they can meet egg. And so, with that, this is not a method that I would recommend. But as I tried to do in Beyond the Pill, is give you, just give you the information and let you decide for yourself. It's interesting to me though. I had so many patients doing the pull and pray that I was like, I have to look into that. And so I included it in the book. Now, I did talk about tubal ligation in this section of the book. And I want to say this. When I wrote the book and I turned in the manuscript, I didn't have information about post-tubal ligation syndrome. So the patient population that I work with, they typically tend to be women under 40. They don't have, like, tubal ligation isn't their number one means of contraceptive. So I haven't dealt with a lot of women with post-tubal ligation syndrome. I've been looking into it a lot more. There are studies in PubMed, and second edition will have post-tubal ligation syndrome. But I just want to acknowledge that at the time I put this book out, that was not on my radar. We still don't have a lot of studies around it or really understand it as well as we need to. That I just want to say that and be really honest about that, this section in the book. And it's something that after, when you write a book, so it was more than a year ago today that this manuscript was in. So the manuscript gets submitted more than a year in advance of when the book is going to publish. And so with that, I'm like, oh, if I had that time back, what I would have done differently. I think that's the number one thing I would have changed, is just bringing in a little more of the concerns around that. Now, I did go into what about the Escher coil? And this is before the Netflix documentary came out, that I talked to you about the problems of Escher and what could happen with that and why I don't recommend that. And I was like, then the Netflix documentary came out and I was like, oh, I was ahead of the curve, but now everybody's in the know. So you made my job easier, Netflix. And the filmmakers, they really should be credited. Now, to make it easy on you, I gave you birth control options at a glance. So there's a table here that you can go through, and it is, the method, what is it, need to know, pros and cons. Like, for example, the pros of a diaphragm, it's affordable because it's reusable, but the cons, it reduces spontaneity. It leaves room for user error. It needs to be refitted after weight change, birth, miscarriage, or abortion. It may cause discomfort during sex, and not to be used if you have a history of pelvic inflammatory disease, toxic shock syndrome, or recurrent UTIs. This is the kind of information we should all get access to when making our decisions. I'd also say I'm not a big fan of the cervical cap because of the failure rate on it. You have to weigh what's best for you. If you're like, I'm okay with the side effect of getting pregnant, that's going to alter your selection. And if you're like, I'm not okay and I can never get pregnant, like that's not on my agenda, then you're going to want to choose a different method. Now, in the key takeaways, this chapter actually is a ton of key takeaways that I gave you. And I also talk about with correct use, condoms are 98% effective, and they also protect you from STIs and HIV. And so, why this is important is because so many women get past hormonal birth control, like the pill or the patch or a depot shot, and nobody talks to them about the fact that they are not protected against HPV, chlamydia, HIV, trichinella, like all kinds of sexually transmitted infections. And so it's a very, very important thing that we should be talking about. Is just because you're prevented for pregnancy, that's not the end of the story. We also need to protect you from a lot of other things like stealth infections like chlamydia or gonorrhea. You can have an infection with that, not know it, and it can scar your ovarian tubes, your fallopian tubes, and block the egg from leaving the ovary and entering, basically meeting up with the sperm. I'm just laughing at myself because I said ovarian tubes. I'm like, sometimes my brain like is moving faster than my mouth can, and I'm like, I'm already to the point where I'm talking about the ovary, and I'm like, okay, dude, there's no ovarian tubes. What you talk about there? All right, so I want to go ahead and answer some questions around chapter 13. Sorry, just a quick question about, okay, don't say sorry for asking questions, ladies. We're not going to apologize unless we truly do something bad. Save your apologies for like when you really need them. You don't have to apologize for having questions about your body. And that's not to shame you or anything. It's just I try to be really mindful about how much I apologize as well. So recurring UTIs, can it be because of antibiotics? I've been on them for a very, very long time. It's destroying my body for sure. I mean, for sure. We know that repeat antibiotics is not good for anyone. So when you're talking about recurrent UTIs, I'd be curious if you're on hormonal birth control or not. Now, this question actually fits in really well with what we're talking about because we're talking about having sex and not getting pregnant. There's also sexual hygiene practices we have to have. So again, what should they have taught us in sex ed? That when you have sex, you should pee afterwards because there are these little critters known as E. coli. So let me set down this book, and my desk is a little bit of a mess right now. I'm like researching a bunch of stuff. I just put out a new article today, and I have like papers of studies everywhere. So with that, let me say this. So with E. coli, these little organisms that you actually find in the gut. So yes, it's coming from the bum, the backside. But like when you have sex, things are messy. Okay. And E. coli. And so like nobody feel like bad about any of this stuff. I'm just going to say that because people are always like, ew, I'm getting UTIs because I'm like dirty. No, that's not what's going on. E. coli have basically arms and legs. So they actually have little arms and they will crawl. And they will crawl and they will find your urethra and they will crawl up in your urethra and they will keep going. But if you pee after intercourse, if any of that friction actually pushed organisms into your urethra, because everything is so close there. Oh, I wish I had my Netter's Anatomy book with me right now so I could show you. So you have your urethra, and then underneath that is the vagina. So the opening of your vagina, it's called the introitus. By the way, there are lots of vagina police out these days. Let me just say this side note where people are like, if you're not using correct anatomical terms at all times, like you're wrong. And it's like the grammar police where they come in and they correct you and you say vagina and they're like, don't you mean labia majora or labia minora? And I'm like, I bet when you say penis, you say penis. You don't say glands or head or, shaft or, any of these anatomical parts. It's okay to start the conversation with just general language. So I just want to be clear about that because that's another thing I see women apologizing about is they're like, am I talking about the right part? And I'm like, the only way we learn is when we hold space for people to have dialogues and not feel shamed. So we have the urethra. Then underneath is the introitus, the opening to the vagina. While you're having sex, you can shove organisms. Basically, the friction will. While you're having sex, you can shove organisms. Basically, the friction will, which is immune privilege, which is to say that once there's an infection in the kidneys, the immune system can't really get there. So with that, we need to pee after sex. That's a really, really important part of all of this. Now, if you're getting repeat UTIs or vaginal infections like BV or yeast infections after intercourse, then that's where I start looking at what lubes are you using, what spermicide are you using or not using, is the ejaculate irritating you, and what are your hygiene practices around that? So that lends itself to like, are you cleaning your diaphragm? What's up with your condoms? How quality are they? Do they have endocrine disruptors in them? Are you switching orifices? I know nobody likes it, like when I go there and they're like TMI, but if you have anal sex and then you have vaginal intercourse, you are making yourself more susceptible to an infection. That path can only go one way. You can have vaginal intercourse and then have anal intercourse, but you cannot have anal intercourse and then switch to vaginal intercourse without risking an infection. And I know some people are going to be like, dude, did she just say that? Yeah, because this is like really what people do. And we shouldn't be ashamed of these things and we should be educating each other about these things. So, with that, sorry, there's so many questions coming in. Um, Okay, tubal ligation and periods have been crazy off since the procedure. Yeah, and I'm hearing that more and more from women who are saying that they are having issues with their hormones after tubal ligation. And so when we actually, make it so those tubes don't flow with the egg anymore. Now, with that, we just figured out that women can't live without their uteruses and not suffer some deficits. And we've seen this in animal studies through cognitive deficits. I think we are going to find in medicine that we've been treating the tubes just like all they are little ushers. They're like the red carpet for your egg to strut down and meet the sperm. But I think we're gonna find out that's my egg. That's what I do at ovulation. I'm like, yo, sperm. Except I don't want a baby, so I'm like, get away. So with that, I think we're gonna find out that the tubes are doing a lot more than what we have always thought. What condoms do you recommend? Spermicide is an irritant, so you want to find spermicide free. Then there's the question of can you do latex, can you do lambskin, or can you do synthetic? And most women I find do better with synthetic. Lambskin isn't as effective in preventing infections. You guys are cracking up right now. So thank you for not just thinking that I'm such a weirdo. Yeah. I'm glad this information was useful about UTIs. Perfect. Awesome. After being on a copper IUD for several years, I got heavy periods and painful cystic acne, was put on birth control for the cystic acne. Can you develop cystic acne from copper toxicity from IUD? So it may not be that what happened is that you got copper toxicity causing cystic acne directly. What may have happened is that copper and zinc will actually compete with one another, and your copper levels may have went high and your zinc levels went low. And as that happened, that made you more susceptible to excess androgens and also made it so your immune system didn't do its job with the acne like it should. And so that could be one possible mechanism. You guys, like everything in women's health, we have not done enough studies to really have the full picture. So that's why, like I was talking earlier on, if you missed it, rewind, go watch it. You can catch it on YouTube immediately when we finish here. Is that we've sought to conquer the female body and shut the business down before we sought to understand it. And why does it operate the way that it does? And so we need a lot more studies. It's like, as soon as they find a solution, it's like when it's women's health, they're like, good enough, good enough. Someone just tagged me in Amy Schumer's post today, and it's actually very fitting because we're talking about, she has this joke about the goop. It looks like someone's blew snot in her panties. She has this joke about that. That's fertile cervical mucus. When I was watching her stand up and she said that, I was like, yay, you ovulated. That's good stuff right there. Like, you want to see that, even though it can be like, I have women in their 40s in my practice who have never ovulated because they were put on the pill at such a young age. And when it happens, they're like, what is this goop? Like, it's so weird. And it's like, it is kind of weird, but it's also something you should celebrate because it's a really good sign of health. Now, what Amy Schumer's post today was about how we'll research all day, every day, how to make a penis hard and harder and last longer. But like when it comes to answering the question about endometriosis or women who vomit their entire pregnancy or better iterations on hormonal birth control or like, is post-birth control syndrome, this phenomenon, and can we, prevent it? Like, who's at risk for it? And, what about all these women struggling with mood symptoms? Like research is just like, you know, they got the pill. It's good enough. And it's really sad. Like, we are seeing Only in the last handful of years is the question starting to come up about what is the long-term impact on women's brains. I'm very, very passionate about this because we spend decades on hormonal birth control. We are told that you can spend decades on birth control. We don't have research studies to actually gauge the long-term impact, but we're treated as if like our reproductive system and us as women as a whole are super expendable. Like we're just expendable. It's like, who cares? Mute her hormones, mute her cycle, shut her up and send her on her way. And that breaks my heart and pisses me off at the same time. And I'm so grateful that there are researchers out of Canada who are starting to answer the question, what happens to a female brain when she spends forevs on hormonal birth control? We don't know. We don't know. But how many doctors have been taught that it's safe and then tell their patients that it's safe? This doctor, so many doctors, and I am a naturopathic physician. Like we were taught, like it's probably not a bad, like a good idea to be messing with the body in that way. But it's also that it's like, well, we also don't know. Like we don't know what's going on, and what we know about hormonal birth control is it does alter the female brain. We engage in riskier behavior. We have a harder time forming social bonds. We select mates differently. And it actually changes our brain on a structural level. Yet no one's thought to ask, and no one's thought it's okay. Like no one's paused and said, yo, so what happens when she's 60 and she just spent 30 years on the pill? And now she has dementia. Is there any correlation? Because newsflash, over 66% of us make up Alzheimer's patients. Us, that's women. So we've got to be asking this question. And it's definitely in my mind of like, how much has hormonal birth control contributed to what we now see with Alzheimer's and dementia favoring women and autoimmune disease and all these other things that we're having a women's health crisis. We have a health crisis overall, but we have a women's health crisis. And we have introduced hormonal birth control with very little pause or question as to what might be happening long term. And a lot of it is because we don't want to see it taken away. And that's my kid right on cue. So sorry about that, guys. That is so mom life right there, where I was like, what's that noise? My husband's with him right now. And my son's doing this thing lately that if he doesn't get what he wants, we are mean. I'm sure if you're parents, you've been there. So you say, I agree. I've had doctors constantly put me on birth control pills and Marina. Yeah. Is copper IUD okay to use? What supplements should I take if copper IUD non-hormonal? So getting baseline testing and tracking your symptoms is a good idea before you start any form of medical intervention of any kind. And certainly contraceptive devices are one of those as well. And so with that, you definitely want to, look into thyroid function, inflammation, your copper levels and your zinc levels. Those are like, that's the minimum I would look at. And then measure that again, like 6 months later when you get the IUD. That way, you know what is true for you and what's changed with being on it. So what's the best way to prevent pregnancy? The best way to prevent pregnancy is the way that's going to work with you, like for your lifestyle and where you're currently at. So there is no one best way. And that sucks, right? Because I'd love to come on and be like, this is the best way. And there's some people who do that, but let's be real here, okay? There is no one size fits all when it comes to contraceptive choices. Like I have met women who love their diaphragm and have never gotten pregnant. Me personally, I would never use a diaphragm because that's just not how I roll. And so that wouldn't be the one best thing for me because that doesn't fit with other, or for another woman because like there's that loss of spontaneity with that. And like, I don't know about you, but these days I'm tired with a kid who has a chronic illness. I have a chronic illness and all the work I'm doing and everything. And if it's the end of the day and the question is, do you want to have sex? You're going to have to go put a diaphragm in. I'm probably not going to do it. And I just totally TMI'd that business, but that's the way it is. That's the way I roll. But with that, like maybe a condom works best for you. Maybe you find that condoms are best. If you're not in a monogamous relationship or, even if you are in a monogamous relationship, sometimes things happen. Like you might want to be using barrier methods on top of hormonal birth control. And so this chapter copper IUD, because like I said, it doesn't work for everybody. And not to say that, oh, everybody, just get a sponge. Like there is no one size fits all. You have to look at where are you at in your lifestyle? What will you follow through on? What are you okay in terms of risks? Are you okay with having a risk of diabetes and possible, stroke, cancer, because you are not okay having the risk of getting pregnant? Like, you have to weigh what is best for you and figure out like what is the best, that's my kid. I'm so sorry, guys. I thought we were having a good day today, but okay. And there's my husband. Something's going, oh my God, this is like, it would be embarrassing if it didn't happen like just about every time I go live. So I'm just going to leave it at that and keep on moving. So you're supplementing with zinc now and following the protocol and coming off of birth control. Thank you for giving us the courage to take back our bodies. Candace, thanks for saying that. I think that is awesome. You should start a women's health research center. That's a big undertaking. I think about doing that. I have a lot of things I'd like to do for women's health, but right now there are a lot of really badass researchers. And it was actually Dr. Felice Gersh who wrote a great book on PCOS. I met her. We were both filming for a new documentary that's coming out. And I met her and I was talking with her, and I came from a research background, and I was talking about next steps. And she was like, you have such a knack for educating the public and talking to women like they're real people instead of like, talking down to someone like, I'm the doctor and you're the patient. Let me like explain everything to you. And she's like, I just think it would be a shame if you did anything else except like go out and speak and educate women about their bodies. And I was like, I never even thought about that. Like, it's like, I think I'm a doctor. You do doctory things. You do doctor stuff. You get on Instagram, you talk about it. And she's like, you really need to be out there, like bridging the gap between taking the science, the clinical information we have, and presenting that to women in a way they can actually use it in their life. And so thank you, Dr. Felice Gersh, for believing in me and inspiring that. I'm just laughing right now because Panda's flare in full effect, and my husband is like handling it so I can be on here, but it is like such like I have such the sloppiest Instagram like YouTube live right now. I'm so sorry, guys. And I also am like, we were just like, if you want, like, you ever want, like, what's legit birth control? What just went down out there? Like, you come hang out with like other people's kids for a while, and you'll be like, yeah, I'm gonna get this dialed in. I'm making jokes. That's how I handle the stress in my life. A lot of the times is like, let's just laugh about it for a minute. Yeah, this is real life. Your husband refers to me as the birth control book lady. That's awesome. I want to say, when we did the chapter review on libido, how many of you had husbands? Like, so some of you actually in real time were like, my husband's looking over my shoulder, he's listening to this. So many of you wrote me messages saying my husband watched the entire libido video. And I'm like, man. And I actually had a woman who reached out to me and said, I would love to see you teach men about women's bodies. And I'm like, let's do it. I do it with my son like every day. And every month that I have a period, it's like he sees blood. We got to have that whole dialogue about what's going on in my body. You went to a new doctor to see about balancing hormones, like lowering estrogen and raising progesterone. I have endo and don't ovulate. And he told me I just need to go into chemical menopause. Okay, there are seasons. There are seasons in our life, and there is a season for menopause, and it will be here. But to tell a woman just to like go into chemical menopause that's some next level mansplaining right there, right? Because talk to some women who've been through perimenopause and menopause and that transition. If you have hormone imbalance now and you're not taking care of that transition isn't going to be smooth. The answer, that is very much like the more allopathic approach, which there's a time and a place for it, but it's that control the body, shut down the body. Your body's wrong. Your body's betraying you. We as people know so much more than our body that is developed over all of these hundreds of years. It's a problem, right? Because like we don't know that much about the body. You guys have heard me talk before. Like, we just figured out that like this story about women not being sexual creatures, inability to orgasm because giving a woman an orgasm is just so difficult. And yet we just discovered how big the clitoris is. It was like this giant structure. And it's like, well, didn't that just burst that little mythology that you've been spreading around? So with that, like, Just because you have endo doesn't mean that that predisposes you not to ovulate. But figuring out how to ovulate and using some of the tools in Beyond the Pill can be really helpful to restore ovulation. Things as simple as seed cycling. Raising progesterone. Sometimes we need to use bioidentical progesterone for a period of time to help with symptom management. Like there's a lot of routes you can go there before you decide to just stop your ovaries from working ever again. Like that season's coming. It's coming for all of us. By the way, I'm a Game of Thrones fan, so I kind of want to say winter is coming. But at the same time, I'm like, is that really like I don't want it to be like menopause, White Walkers are coming for you. No, it's not like that. But just to say, like you could totally tell us watching Game of Thrones this weekend. But just to say that like there is a season and like there's no need to rush into it. You're laughing because you're a pediatric physical therapist. Yeah. Yeah, then no, poor me with the real life situation going on in the background. But thanks for saying that. This is life, and like you guys have known, I'm really honest with you with like what goes on. It just is what it is. Like I have a kid with pandas, and I could kill myself trying to present a perfect life and come on only when it's convenient. And like what would happen? I would burn out. I would never be back on Instagram again or YouTube or doing any of these things. And I would just stop. Like, whatever. Like, I'm going to roll with it. This is my life. My life is messy. It's not perfect. It's unpredictable. By the way, I'm an A type and I love to plan everything. So it's a little bit hard for me, but it's also a really great lesson. So, yeah. Is there any way to know if you have estrogen dominance without testing? Take the quiz in chapter 1 of Beyond the Pill. Lab testing is great, but when it comes to hormones, your symptoms tell so much. They tell so much. Now, it's important. I think thyroid testing is a must and insulin testing. But when it comes to sex hormones, we can't test you every day out of your cycle. Well, we can with a certain test, but it won't account for like thyroid every day of your cycle and cortisol every day of your cycle. But knowing your symptoms can really help your clinician guide you in what's going on. Thank you for saying my skin is glowing and beautiful. Yeah, I had to take a lot of rest. If you'd saw me last week, I almost came on live last night. I had a hair in a bun on top of my head, and I was tired. Thanks for saying I don't need to apologize for being a mom. My goodness. Did I say earlier not to apologize? And I apologize. See, can an IUD put you into perimenopause? Not necessarily, but with hormonal IUDs, you can stop ovulating and it can happen at any time. So sometimes women continue to ovulate and then they don't, they just stop ovulating and then it can feel like perimenopause. But if like you're over 45, it might not be the IUD, it might just be season that you're moving into perimenopause. I feel like I want to come up with seasons for these menstrual cycles. It's like, yeah, when you get your period the first time, it's like spring, but it's kind of like it can be that like, that spring storm that's just like whips all the trees around sometimes. And then menopause may feel a little bit about like winter, but like, I don't know. Like I'm just spitballing right now. I don't see you said respond to Mellow Lady 72. I don't see that. Okay, sorry. Mellow Lady, if you want to drop that comment back in, I didn't see that. Your husband's enjoying this right now. Awesome. Did he get in on the pull-out method, I'm wondering? Did he catch that? My friend is reading your book and has changed her life. Most important, matcha and liver cleansing. The liver cleansing information is awesome. And what I've heard and it's awesome because my patients helped me develop it, not because I'm awesome. It's because I've had so much feedback from patients over the years. And I really sought out, hey, Seattle, thanks for being here. I really sought out to make delicious recipes because they're like, I'm a foodie. And if you're like, I love me some Chinese medicine docs. It's my great friends, but like when they give me that swamp water to drink and I'm like, "Really? I have to drink that?" And I was talking today with Dana James. I hate organ meats. I was living in Paris and I was like, I don't care how good you try to make this like liver. I don't like this liver. But that's also the 3-year-old in me, I think. So with that, it's like, yeah, that's just to say that like I wanted to make sure the recipes were delicious. I haven't seen Mellow Lady's question come back through. Oh, there it is. My period stops at day 3 and then spotting until day 9. Well, that's not cool. Very dark. Could this be low estrogen indicator? Yeah. So that's definitely an indicator of a hormone imbalance. So it's not uncommon for our flow to stop and then start again. So that's not uncommon. But to spot for 9 days and it be very dark, that very dark is likely, is it like, if it's like brown, that's oxidation of the blood because you're not getting the uterine contraction is not efficient in removing the uterine lining. So it could be estrogen or progesterone issues going on, but it also could be that, like, you know, bringing in things to support. So let me like red raspberry leaf. So to support the contraction of the uterus, red raspberry leaf. It's almost ready in my garden. I will show it to you soon. I grow red raspberries and then I harvest the leaves and I drink that as a tea every day. It's very nourishing. It's a tonic for the uterus. It helps with delivering babies. So you may have heard that there because it strengthens the uterine muscle and it helps with blood perfusion to the uterus. Now, the other thing so that's one thing that we can try. The other thing is thinking about utilizing, so something like my balance supplement, which is a formulation that has DIM in it. It also has black cohosh, Vitex, and things to help optimize your hormones all together. And with that, bringing that in to start to harmonize the hormones. And then you may want to check like your exercise as well. So this is a little bit of an outlier, but if you're doing inversions, so like handstands, headstands, pelvis in the air while you're on your period, it's not true for all women, but for some women, I have seen it because I was a yoga instructor for 10 years. I have had like people that would be in my class and they're like, if I do an inversion, my period will stop and then it comes back and it's this like goopy black stuff like 2 days later. And I'm like, okay, don't do the inversion. Your body's like, yo, don't do that. Listen to your body before you listen to your yoga instructor. How does dehydration play a part in hormone issues? Let me take a drink of tea here and then I want to talk about that. I'm drinking my this is Nason's mushrooms and lion's mane. You guys know I drink lion's mane every day. I love that stuff. Makes me so much smarter. So, dehydration. Let's talk about that for a second. So, when you become dehydrated, that will signal stress to the adrenal glands. Now, your adrenal glands, on top of producing cortisol, DHEA, epinephrine, norepinephrine, also produce aldosterone, which governs your blood pressure. You can throw yourself into HPA dysregulation, otherwise known as adrenal fatigue, by way of not drinking enough water and being dehydrated because that creates stress on the adrenal glands. Now, as I talk about all the time, if you've missed this in other videos, it's coming back at you again because it's that important. The hormonal structure we want to think of is a pyramid. And at the base of the pyramid, that's where our adrenal glands sit, and insulin is involved there as well. Above that comes the thyroid, and the very tip of top is sex hormones. And so if the foundation's not right, forget the rest of it. It's all going to be imbalanced until you address the foundation of those hormones. And so if adrenal issues are your problem, as you figured out in chapter 1 of Beyond the Pill by taking the quiz, you want to work on that. And one thing is making sure you drink plenty of water, but not over drinking water. So we also need electrolytes in that as well. And so this is something that I'll tell patients, like, drink water, drink coconut water, salt your food, make sure that you're getting your electrolytes in as well. I do not have a whole house water filtration system. So great question there. I don't have a whole house water filtration system because my house is well over 100 years old. It's like 110 years old. And to get that, I have to replace every single pipe in my house. And to do that, I have to replace every single pipe in my house with plastic. So right now we're at a place where we're like, we don't really want to make those changes. But I do have a filtration system on my shower, and I use a Berkey water filter in my kitchen. I actually have I was just talking to my friend, environmental toxins nerd on Instagram, Laura Adler. I have a filtration system on my fridge that I then run through my Berkey filter. And then I always get these companies who reach out to me and they're like, because this is how it goes. Like when you're considered an influencer, companies reach out to you and they want to send you their product and they want you to promote it. I only ever promote things I actually use or I recommend to patients. I won't just take everything and anything that comes my way, because that's just weird to me. But with that, there's all these companies that keep reaching out to me and they're like, we filter fluoride, we filter fluoride. I'm like, you might want to check where I live because fluoride is not an issue in Portland. We don't fluoridate our water. But it's funny to me that they're like, we want you to promote that and like share about that. And I'm like, yeah, fluoride's definitely an issue for your thyroid, but also like, I'm more concerned about like how, like what filters are you using? What's going on? What are the other things? So yeah, you live in Texas, they have horrible water. You know, one of the things that I was living in Paris and I don't even know about the water in Paris. I did not test it, but I got a travel Berkey. So I got a little mini Berkey to be with me there because I found I wasn't drinking water. And then I was drinking out of all these water bottles. If you guys were with me through that, you saw that I was like, oh my God, I'm drinking so much sparkling water out of these water bottles because I was like, I can't stand the taste of the water here. So with that, sorry, Instagram, someone started calling me. I thought I had, well, I did have do not disturb on. So they've been calling me 3 times. What are my thoughts on arm birth control and implant? That you want to read Beyond the Pill where I take you through all of the hormones there. So is there a way to tell if, okay, I answered that one. I'm queen for answering all these questions. Very helpful for all the ladies and for promoting female health. Yes. Awesome. So sorry, Margarita, send the question. There seems to be several people that want your question to be answered, but I can't find it through scrolling. So go ahead and give that to me again. What could cause, so if you're having clots in your menstrual blood, so the question is like, what could cause clots in the menstrual blood? You want to look at Beyond the Pill, the liver chapter. And in the liver chapter, I talk about estrogen metabolism and what will make clots in your menstrual blood. And I also talk about that in the Taking Back Your Period chapter 4 of that. You are welcome. You guys, thank you for saying thank you. That is awesome. Duke 80A. That's kind of fun to say. I just got your book and can't wait to figure out if I have SIBO. Also, my period has come 1 week early for the past 3 months. So you'll want to go ahead and look at chapter 4, and you want to look at periods coming too frequently, what's known as a luteal phase defect. And so that's often an issue with not getting your progesterone to stick around. The corpus luteum is not as strong. And so things I talk about in that chapter are like vitamin C rich foods, vitamin C supplements, making sure, you know, that you keep stress low, and then considering things like Vitex as well. Let me look. I want to see. I don't know if Margarita's still on here, guys. I can't find her question. So if you want to ask it, go ahead and ask it. My sister's doc wants her to do an IUD, and she has suspected endometriosis and also has PCOS like me. What are your thoughts on that? So your sister should definitely read chapter 8, the Reversing Metabolic Mayhem chapter of Beyond the Pill. It's where I talk about PCOS, insulin resistance, and the concerns with hormonal birth control. Women with PCOS are already at highest risk for stroke, heart attack, and cardiovascular events. And so using hormonal birth control is an added layer to that we must recognize. And these PCOS women are at much higher risk. Now, hormonal birth control will not fix the root cause of PCOS. PCOS is a metabolic disorder rooted in inflammation, insulin dysregulation, and likely gut dysbiosis. PCOS, endometriosis, 2 women's health issues we have very limited information on, and we need a whole lot more on. Because here's the thing. We're dumping all this money into diabetes research, and yeah, diabetes is important, but what predisposes women to diabetes like crazy? PCOS. So maybe we should investigate that, because do we need to treat the diabetes, or do we maybe need to go into what is going on with the PCOS that caused her to develop diabetes in the first place? That's the why I want to see answered. So with that, you want to read Beyond the Pill, because if you know that hormonal birth control disrupts the microbiome, causes insulin resistance, is inflammatory, and is basically doing the same things that metabolic condition can do, is it really the best option for you? Now, when it comes to the IUD, the progestin-based IUD, the other thing that we need to consider is that Well, it's very common to vilify estrogen all day, every day, whether it be real or synthetic. It's not fair because estrogen, your natural stuff, isn't all bad. But when it comes to birth health, and so we need a lot more research to understand this. But your natural progesterone actually heals your brain after a head injury. It helps with neuronal pathways being developed. That means you get smarter with life and you learn new things and you pick up new skills. Whereas progestin doesn't do that. And progestin may have a negative impact on brain health. Um, and so you definitely want to look at that with PCOS, and we want to get to the root cause. I see other PCOS questions. I just saw the question, you went to my site and you can't find the lab orders. I'm not sure what lab orders you're talking about, but if you're talking about the lab guide that comes with, so when you grab Beyond the Pill, you can go to beyondthepillbook.com. And if you go to beyondthepillbook.com, that's where you'll get a lab guide. And then I give you a link to direct lab ordering. So that way you can order your labs yourself while you look for a doctor that can help you. Because I know it can be hard to get a doctor to help you with that sometimes. So Instagram peeps, hey, gluten-free school, thanks for being here. I've got less than 2 minutes remaining. So I'm going to try to answer a few more questions here before I jump off. Remember, the Instagram live lives for 24 hours, but I'm recording it on YouTube at the same time. So as soon as this is over, you can jump right over to YouTube and get in on all of this if you missed anything. The key to keep the body as natural and in balance as possible. No. Of course, taking into consideration all of, I'm not sure. I think I missed something. Yes, all the things in our environment. Go to drbrighten.com right now. I published a new article today about environmental toxins and your hormones. For those of you asking about yeast infections, there's an article that came out a few weeks ago where I talk about yeast infections. I talk about medications and natural treatments for yeast infections and how to root cause that business so you don't just keep treating symptoms. So definitely check that out. You quit the NuvaRing, then diagnose with RA. Any advice? Gut check chapter of Beyond the Pill, and you will learn what happened with that. Because with rheumatoid arthritis getting triggered after stopping the NuvaRing, abrupt shifts, so starting or stopping hormonal birth control can be a triggering event for autoimmunity. Read the gut check chapter because I give you a whole lot of information about autoimmune disease and what to do about it. What about chaste tree berry? When I say Vitex, Vitex is chaste tree berry. So when you read Beyond the Pill, I don't think I say chaste tree berry very much because I am trained herbalist. So I use the botanical names. And so we talk about Vitex. Vitex is tremendous with helping with progesterone and lady part problems. So guys, Instagram's counting down. I've got 10 seconds to go here. I want to say thank you so much for being here. BeyondThePillBook.com is where you can get your bonuses. And thank you so much for supporting Beyond the Pill. It's such an honor to be chatting with you. And I will be going live again where we will talk through the recipes in Beyond the Pill and help answer any questions you have about recipes. Remember, if you've missed chapters 1 through 12, you can go watch those now on YouTube. And I take you through every single chapter in the book. And I see Kathleen is saying, thanks for discussing dehydration. Okay, the bodies, you're reading a new book about that. That's awesome. So great. And then Duke 80A80, I hope that you go to beyondthepill.com and grab that lab information. And again, if you are wanting to know what's in Beyond the Pill, this goes way beyond hormonal birth control. In fact, this is a deep dive into common issues that women face, things like estrogen dominance, menstrual irregularities, having issues with thyroid disease, adrenal disease, inflammation, as you just heard, autoimmune disease, and certainly libido and baby making. So I've gone through so far chapters 1 through 12. Today is number 13. You can go watch all of those on my YouTube channel. If you haven't subscribed yet, be sure to do that. Then you get a notification when I go live and you can be here with me. I will see you next time.